you had PRP, maybe you even had stem cells. You were told it would help your knee, and for a while, maybe it did, or maybe it didn't help at all, and now you're frustrated. You're wondering, was it a scam? Was it the wrong treatment? Or is something else going on? In most cases, something else is going on. And in this video, I'm going to tell you exactly what that is. Because after years of treating joints with orthobiologic procedures, I have seen a pattern that nobody talks about enough. Orthobiologics don't fail because they are bad treatments. They fail because we ignore the environment they are injected into. I am Dr.A.K. Venkatachalam, founder of the Madras Joint Rejuvenation Center in Chennai. I trained in the UK. I'm a fellow of the Royal College of Surgeons, and I've been practicing joint preservation and regenerative orthopedics for over 2 decades. At MJRC, we use treatments like PRP, SVF and PRS, and we get good results. But we get good results because we don't just inject and hope. We prepare the body first. That preparation, that foundation is what this video is about. Let me start with a quick explanation. Orthobiologics are treatments that use your body's own biological material to help heal damaged joints. The most common ones are PRP, platelet-rich plasma, your own blood concentrated re-injected, SVF, stromal vascular fraction, cells extracted from your own fat tissue, PRS, platelet-rich trauma, a combination approach we use at MJRC. The idea is simple and powerful. Instead of cutting, replacing, or suppressing, we stimulate healing. We give the body the tools to repair itself. But here's what the brochures don't tell you. Imagine you want to plant seeds in your garden. You buy the best seeds in the world, expensive, proven, but before planting, nobody checks the soil. The soil is acidic, it's toxic, dry, inflamed, and you plant anyway. What happens? They don't grow, or they grow and then die. And then you say, these seeds didn't work. That's exactly what happens with orthobiologics. The treatment isn't bad, the soil is bad. In medicine, that soil is the joint microenvironment, and when that environment is toxic with inflammation, high blood sugar, insulin resistance, poor circulations, the cells we inject simply cannot function. So, what are the main metabolic factors that sabotage these treatments? Let's go through them. Number 1, uncontrolled blood sugar and diabetes. This is the most important, especially in India. High blood glucose creates a toxic environment. It causes oxidative stress, chronic inflammation, damage to the joint lining, and it disables the very cells we are trying to activate. We inject healing cells into a hostile environment. They are outnumbered. Number 2, obesity and metabolic syndrome. This is not just a weight problem. Fat tissue is biologically active. It releases inflammatory chemicals, Adipokines, that directly interfere with healing. So obesity is not just mechanical, it is chemical. Number 3, chronic inflammation from diet. Refined carbohydrates, processed foods, industrial oils, these keep the body in a constant inflammatory state. An already inflamed joint cannot overcome the double burden. Number 4, poor sleep and chronic stress. Cortisol, the stress hormone, breaks tissue down. Chronic stress undermines regeneration. Number 5, anemia and micronutrient deficiency. Healing needs raw materials, iron, vitamin D, vitamin C, zinc, protein. If these are lacking, healing cannot happen. So, when a patient comes to me for PRP, SVF or PRS, I don't just book an injection. First, we assess metabolic health, HbA1c, body composition, vitamin D, CRP, ESR, triglycerides, diet, lifestyle. And then we optimize the system, control blood sugar, reduce weight, correct deficiencies, improve lifestyle. Only when the soil is ready do we plant the seeds. This is why at MJRC we use the PRASAD Protocol, because we don't treat just the joint, we treat the whole patient. And this is the future of regenerative medicine. Now here's what you can do starting today. Check your HbA1c. If it's above 6.5, control it first. Vitamin D. If it's below 30, correct it. 3. Reduce sugar and processed food. 4. Walk. Even 20 minutes helps. 5. Sleep 7 to 8 hours. These are simple steps, but they are the difference between a treatment that works and one that fails. If you are dealing with knee pain or considering orthobiologic treatment, understand this. There is a smarter way to do this. At the Madras Joint Rejuvenation Center, we treat patients from across India and around the world. Yes, we treat joints, but more importantly, we treat people. If you want to know whether you are a candidate and how to prepare your body properly, reach out to us. Links are below. If this has helped you, subscribe, share and comment. I read everyone. Until next time, take care of your joints and take care of your metabolic health. They are more connected than you think.